All right, welcome back. We're on topic number 5 of the top 10 critical and costly Medicare mistakes to avoid. Number 5 is not knowing the difference between IEP, AEP, OEP, and SEP. OMG, there's just too many terms and terminologies in the Medicare world. That's only a fraction of them. So let's dissect them one by one. IEP, your IEP is your initial enrollment period, which is a 7-month period, 3 months before you turn 65, the month of your birthday, and 3 months after your birthday. The date that Medicare begins will depend on when you actually sign up. So if you're under 65 and you're eligible due to a disability, you would automatically be enrolled. Now, remember, if you miss your initial enrollment period or your IEP, you're going to have to enroll during the general enrollment period. So we just happened to have a client contact us yesterday. He said, Gary, my husband is now 67. He's not enrolled in Part B. No one told us. We didn't know what to do. And so now, unfortunately, we are now in the month of November. He will have to wait until January, February, or March of each year, which is known as the general enrollment period, to sign up for his Medicare Part B. And then his Part B effective date will not be until July 1 of the following year. So remember, if you don't sign up for your Medicare Part B when you first become eligible, that means that you'll have to wait till the GEP, or the general enrollment period, that happens the first quarter of each year, January, February, and March, and your Part B effective date won't be applicable until July 1. So make sure you get it right. If you have questions, be sure to contact somebody that you trust, or an independent agent, or contact us at medicarejourney.org. AEP. So the AEP is the annual enrollment period. The annual enrollment period happens each year from October 15 all the way through December 7th. The AEP is the time where you, if you're a Medicare beneficiary and you're on a prescription drug plan, you can make changes to your prescription drug plan. Because the drug plans do change, the formulary changes every year. So it's important that you make sure that you do a review of your Part D prescription drug plan. The AEP also helps those who are on a Medicare Advantage plan, if they're unhappy with it, to switch to another Medicare Advantage plan. So if you're on an MAPD or a Medicare Advantage plan and you don't like it, or you want to go to another MAPD plan, you can do that. You can do that without evidence of insurability, of course. Additionally, what happens typically around the month of September, you will get your ANOC, which is your annual notice of change. Your ANOC in that letter is going to tell you what has changed and what is no longer covered on your plan. And that is the opportunity to have a review with your current agent, or if you don't have an independent insurance agent that specializes in Medicare, contact medicarejourney.org and we'll be able to help find an independent agent to help be your guide. Also, another thing that you can do, if you're on a Medicare Advantage plan during the AEP, the annual enrollment period, and you want to go back to original Medicare, because I think most people don't realize if you select a Medicare Advantage plan, you are no longer in original Medicare. You are not using your Medicare A and B. You are now in managed care. And most people, you see these commercials everywhere with the Football Hall of Famers and the celebrities trying to call you, entice you to call a toll-free number so they can enroll you in a managed care plan. Again, there's not a one-size-fits-all solution for Medicare. So it's important that you get your Medicare right the first time, because the decisions you make today could potentially last you an entire lifetime. So if you're on a Medicare Advantage plan, you want to go back to original Medicare and then sign up for a supplement plan, like so many people do. When they get sick, they're on a Medicare Advantage plan, they realize that there are major out-of-pocket expenses, and maybe the facilities or a doctor they want to go see doesn't accept Medicare Advantage. They want the flexibility to go to a supplement plan. Now they have to answer, typically will have to answer underwriting questions to be approved. And if you've already have a critical or chronic illness and you're beyond your trial right period, we'll talk about that later, but you're beyond your trial right period, you will not be able to get a Medicare supplement plan. So again, it's important that you work with an independent, professional, unbiased agent that specializes in Medicare that can help be your guide and give you the direction that you need so that you can make an informed decision about your Medicare. One additional thing, for those of you who are on a Medicare supplement plan during the annual enrollment period, remember, for those of you who are on a Medigap plan, or also known as a Medicare supplement plan, you do not need to do anything. Do not let anyone try to force you or entice you to disenroll from your Medicare supplement plan to go to enroll in a managed care or Medicare Advantage plan. Very important. Listen, if you're thinking of doing that, for whatever reason, the only reason might be is because you can no longer afford your Medicare supplement policy. Make sure you reach out to the professionals at MedicareJourney.org to inquire about what would be the best course of action for you. But trust me, you don't want to leave your Medicare supplement plan if you can avoid that at all costs. Okay, now the OEP. The OEP is the open enrollment period that happens each year from January 1 to March 31. It's for those of you who are on a Medicare Advantage plan, who are selected a Medicare Advantage plan, and maybe for whatever reason you're not happy with the plan, your doctor maybe doesn't accept the plan, you were sold a bill of goods that you were not aware of, and now you need to switch to another plan with maybe a better or a more expansive network or with better benefits, or the better drug formulary where your drugs are covered properly. That's the time that you can make that change. That's the only thing you can do. So if you're on a Medicare, if you're on a prescription drug plan, there's nothing that we can do for you. So that's why you got to make your drug plan selection during the AEP and make sure that you work with the right agent who knows what they're doing when it comes to Part D plan. So if you're on a Medicare Advantage plan, remember, you can go to another Medicare Advantage plan. You can go back to original Medicare. So if you're on an MAPD plan, you can go back to original Medicare, and then you can sign up for a standalone Part D plan, and you can also sign up for a Medicare supplement plan. But remember, depending on your situation, majority of the time, you will have to qualify with health underwriting to go into a supplement plan. And again, I can't stress the importance of getting your Medicare right the first time. All right, let's talk now about SEP, or special enrollment periods. There are so many different types of special enrollment periods, and there are way too many to mention here on this quick video. So we're going to give you the gist of SEPs that you can follow along. The first is that you move to a new address. So if you are on a Medicare Advantage plan and you move to a different area, let's say that you're in Ohio and you're going now to Florida or another state, or maybe you're coming from, if you're in Florida and you're going from South Florida to North Florida, you are changing your plan service area. That gives you an SEP, or a special enrollment period, where you can change your plan. Also, if you've moved in or out of a skilled nursing facility or a long-term care hospital, that gives you another SEP. If you're no longer eligible for Medicaid, you've left your employer coverage or your union coverage, here in the state that gives you a guaranteed issue, actually. If your Medicare plan was terminated or it didn't renew with Medicare, that gives you an SEP. Also, if you're eligible for Medicaid and Medicare, you qualify for extra help through LIS, or a low-income subsidy through a Medicare prescription drug plan, or you dropped a Medigap or a Medicare supplement policy the first time joining a Medicare Advantage plan. Remember, we talked before about the trial right period. So there are two types of trial right periods that you have. One is for Medicare Advantage, and another one's for Medicare supplement. So at 65, you enroll in a Medicare Advantage plan. You want to give it a test drive for 12 months. You have a 12-month trial right to get out of that Medicare Advantage plan. And let's say now that you have a pre-existing condition, you have a chronic illness or a critical illness, and that Medicare Advantage plan is going to be not the right fit for you, and you want to go to a supplement plan, or you can go to any doctor or hospital that you want to without any networks. You can do that during the first 12 months of turning 65 if you're on a Medicare Advantage plan. Again, that is the trial right period for Medicare Advantage. Also, for Medicare Supplement, if you're on a Medicare Supplement plan, and let's say now at 65 you took your supplement and now you're 70 and somebody comes to you and says, you're silly, you got to get off your supplement plan because I'm on a plan I'm not paying anything for. Zero premium. Medicare Advantage, you want to switch to an Advantage plan. So you go ahead and you make the decision. After 5 years of being on a supplement, you want to go to an Advantage to try it out. Within the first 12 months, you don't like it, you can go back to your original Medicare supplement company, your carrier, and go back to that same supplement plan you're on without any underwriting questions. All right? So that's important. Now, the problem arises, and we see this all the time. If you're on a Medicare Advantage plan and you go beyond your trial right period of 12 months, and now you're 70 or 72 or what have you, whatever the age it is, it doesn't really matter. It could be 66. And now that you've come across or experienced a critical illness or a chronic illness, and now you want to be on a supplement plan so you can go wherever you want to go without any worries of networks or limitations or impediments, to be able to have the flexibility and freedom to go to choose any doctor you want to go to. The problem now is that you have to answer no to all the underwriting questions to qualify to have a Medicare supplement plan. So very important to get your Medicare right the first time. Again, if you have questions about trial right periods, about IEP, OEP, SEP, AEP, contact us at MedicareJourney.org at 833-267-6700.